You know, that worry you feel as a pet owner, that deep concern for our dogs and cats. It's something we all share, right?
Absolutely. They really are part of the family.
Plain and simple. So today we're diving into something, well, really important. Understanding some of the serious diseases that can affect them.
Mm-hmm.
Think of this as your shortcut to being informed, but hopefully not overwhelmed, about keeping your furry family members safe.
Exactly. We've spent time with a Fatal Pet Diseases guide, and our goal today is really to pull out the crucial bits.
Okay.
We want to give you the knowledge to spot potential issues early and maybe even more importantly, focus on what you can actually do to prevent them.
Good point. It's about being prepared, not scared.
Precisely. It's about preparedness. We'll touch on a range of illnesses for both dogs and cats because, understanding these threats is really the first step in protecting them.
Okay, let's unpack this, starting with something that hits puppies particularly hard. Canine parvovirus. Parvo. Sounds nasty.
It is indeed. Parvo is a highly contagious viral illness. It primarily targets unvaccinated puppies and younger dogs.
How does it spread?
Well, it spreads through direct contact with contaminated feces, surfaces, or even infected animals themselves.
Okay.
What's interesting, or rather dangerous about the parvovirus is its structure. It's what we call a non-enveloped virus. Meaning it's incredibly resilient in the environment. It's like it has this tough outer shell that just lets it survive for a long, long time outside a host.
Wow. And when a puppy actually gets it, the symptoms are just awful.
They are. We're talking severe vomiting, often with blood in it.
Oh, no.
Really bad diarrhea, again, often bloody, extreme lethargy. They just seem to crash completely.
No energy at all.
None. And a total loss of appetite. They might have a fever or sometimes, surprisingly, a dangerously low body temperature. Their little bodies are just overwhelmed.
Sounds like it.
Yeah, the virus attacks cells that divide rapidly. And in young animals, those are abundant in the gut lining and the immune system.
Oh, okay.
This rapid destruction leads to severe dehydration, and it makes them incredibly vulnerable to other infections, what we sometimes call opportunistic infections.
Infections that wouldn't normally be a problem.
Exactly. They take hold because the immune system is compromised. Now, we don't have a direct cure for Parvo itself, the virus, so the veterinary focus is all on intensive supportive care.
What does that involve?
Getting fluids into them, usually intravenously, to fight that severe dehydration, giving medications to control the relentless nausea and vomiting, and antibiotics.
Why antibiotics if it's a virus?
Good question. It's to fight off those secondary bacterial infections we just mentioned. It's really a race against time, keeping them stable until their own immune system can hopefully rally and fight off the virus.
And the guide really stresses prevention for Parvo, making it sound almost non-negotiable. And that means vaccination.
Absolutely. A full series of vaccinations for puppies given at the right times, followed by the necessary booster shots. It's incredibly effective.
So those early vet visits are crucial.
They are a critical shield against this disease. And think about this. Before widespread vaccination, Parvo outbreaks were just rampant and devastating.
Right.
Now, we still see cases, sure, but they're far less common in dogs that are properly vaccinated. That's herd immunity working, It even protects the ones who might be too young or have other issues preventing vaccination.
That makes sense.
But it's a stark reality. The fatality rate for Parvo can still be very high, especially in those vulnerable, unvaccinated puppies.
That's really sobering. Okay, switching to our feline friends.
Yeah.
Is there something similar for cats? Feline panleukopenia, sometimes called feline distemper?
In many ways, yes. Feline panleukopenia is also caused by a parvovirus, just a different strain that targets cats.
Okay.
It's just as highly contagious and can be particularly devastating, especially in kittens.
Panleukopenia. Does the name tell us something?
It does. Leuko refers to white blood cells, and penia means a deficiency. So the virus literally attacks and destroys all types of white blood cells.
The core of the immune system.
Exactly, which leaves the cat incredibly vulnerable to all sorts of other infections.
And the symptoms sound horribly familiar. Vomiting, diarrhea, often bloody.
Fever, anemia, that's a lack of red blood cells, and significant dehydration. It's a brutal illness, especially for a tiny kitten.
So treatment is similar to Parvo too. Supportive care.
Very similar. It centers around intensive supportive care. Aggressive fluid therapy is key, fighting that rapid dehydration. Antibiotics to ward off secondary infections, antiemetics for the vomiting.
And getting treatment quickly is vital.
Absolutely crucial. Early and really intensive treatment gives them best shot at survival. Acting fast is everything.
And again, vaccination is the key preventative measure.
Without a doubt, especially for young kittens who are most susceptible, and also for any cats that go outdoors where they're more likely to encounter the virus.
Okay, let's switch gears again. Another serious one for dogs, canine distemper.
Ah, canine distemper. This one's particularly challenging because it can hit so many different body systems. The respiratory system, so you'll see coughing, nasal discharge. The gastrointestinal system, vomiting and diarrhea again. And perhaps the most worrying, the nervous system.
Oh, wow. How does it spread?
It's highly contagious, spreads easily through the air, coughs, sneezes, virus droplets.
Airborne.
Yep. And it can also survive for a bit on surfaces, shared items, so indirect transmission is possible too.
The range of symptoms sounds really broad. It can start like a cold.
It often does. Runny nose, goopy eyes, maybe a little cough, but then it can progress to the GI issues. But yeah, it's those potential neurological complications that are really frightening.
Like seizures.
Seizures, tremors, muscle twitching, even paralysis in severe cases.
That sounds terrifying.
It is. While the initial signs might seem mild, that potential for severe neurological damage is what makes distemper such a serious threat. And unfortunately, like Parvo, there's no specific antiviral drug that kills the distemper virus.
So it's supportive care again.
Supportive care is the mainstay. Managing symptoms, preventing secondary infections because their immune system is weak. But if the disease progresses to really affect the nervous system significantly,
And the prognosis isn't good.
often very poor, unfortunately. And sadly, euthanasia is sometimes the kindest option to prevent further suffering in those advanced neurological cases.
Which just highlights, again, prevention.
Right.
Routine vaccinations are the best defense.
Absolutely. Keeping dogs up to date on their shots gives them strong protection. And, just being careful about exposure to dogs with unknown vaccination histories.
Makes sense.
Yeah.
Now, let's talk about a disease that I think genuinely strikes fear into almost everyone, humans and pet owners alike.
Rabies.
Rabies. Rabies is, perhaps the most feared disease, and for very good reason. It's zoonotic, meaning it affects all mammals, including dogs, cats, and us.
And the fatality rate.
It's virtually 100% fatal once clinical symptoms actually appear. There's really no coming back from it at that point.
How is it usually transmitted? Typically through the bite of an infected animal. The virus is present in their saliva.
And the symptoms are, well, they're infamous, aren't they? The behavioral changes.
Very much so. Dramatic changes. It could be sudden aggression or extreme fearfulness, things totally out of character.
Or the drooling.
Yes, that excessive drooling or foaming at the mouth is classic. Then comes paralysis, which gets progressively worse. Difficulty swallowing. And tragically, death usually follows within days once those clear neurological signs start.
But there's no treatment when symptoms show up.
None that's effective, no.
Well.
However, and this is critical, if a person or an animal is bitten by a potentially rabid animal, there's post-exposure prophylaxis.
What's that?
It's a series of vaccinations given after the exposure, promptly. If administered quickly, it can be highly effective in preventing the virus from taking hold and causing disease.
So immediate medical or veterinary attention after any suspicious bite is absolutely vital.
Urgent, yes, don't wait.
And prevention. Obviously, vaccination is key here and often required by law.
Yes, vaccination is crucial and legally mandated in many places for dogs, sometimes cats too. It's our main defense. That and being vigilant, avoiding contact with wild animals, especially any that are acting strangely.
Definitely. Okay, let's move on to a feline-specific concern. Feline leukemia virus, or FLV.
Right, FLV. This is what's known as a retrovirus.
Like HIV in humans.
Similar mechanism, yes. It integrates its own genetic material into the host's DNA, the cat's cells. It primarily targets immune cells.
So it weakens the immune system.
Significantly. This makes the cat much more vulnerable to a whole range of secondary infections. It can also lead to anemia, a lack of red blood cells, and unfortunately, certain types of cancer too.
How does it spread between cats?
Usually through fairly close contact,
Right.
primarily saliva, think mutual grooming, sharing food and water bowls,
Right.
but also through blood, nasal secretions, fighting, and even from a mother cat to her kittens.
And the symptoms? Are they obvious?
They can be quite varied and often develop slowly, gradually over time. You might see things like a persistent fever that just doesn't go away, unexplained weight loss that keeps progressing, pale gums, which indicates that anemia, lethargy, just a general lack of energy, and those recurring chronic infections like respiratory infections or skin problems that keep coming back or are hard to clear up.
It sounds like it can cause a lot of different problems because it hits the immune system.
Exactly. Cats can present with a whole host of seemingly unrelated health issues, and unfortunately, because it's a retrovirus integrated into their cells, there's currently no cure for FLV.
So what can be done for an infected cat?
Treatment really focuses on supportive care, managing the symptoms as they pop up, treating those secondary illnesses vigorously. Sometimes antiviral medications might be used to try and slow the virus's progression.
Okay.
And importantly, keeping an FLV-positive cat in a stable, low-stress indoor environment, that can really help prolong their life and, crucially, reduces the risk of them spreading the virus to other cats.
Right, preventing spread is key. So the guide mentions vaccinating at-risk cats.
Yes, there is a vaccine. And routine testing of any new cat before introducing them into a home with existing cats is highly recommended.
And keeping infected cats indoors.
Absolutely vital for their health and the health of the wider cat community.
Okay. Now, another feline disease with a pretty ominous name. Feline infectious peritonitis, or FIP.
Ah, FIP. Yes, it's a complex one and historically a very, very serious disease in cats.
What causes it?
It's caused by a mutation of the feline coronavirus. Now, feline coronavirus itself is actually super common in cats.
Really?
Yeah, most cats get exposed to it, and usually it only causes mild, maybe transient diarrhea or respiratory signs, or often no signs at all.
So it's usually harmless.
Usually. But in some individual cats, and we don't fully understand why this relatively benign coronavirus can mutate inside the cat into a much more aggressive form, and that's what leads to FIP.
And for a long time, FIP was considered fatal.
Almost universally fatal, yes, once it developed and became clinically obvious.
The guide mentions two forms, wet and dry.
That's right. The wet or effusive form is maybe the more classic presentation, where fluid builds up in body cavities. Most often you see it in the abdomen, causing that characteristic swollen, fluid-filled belly.
Okay.
The dry or non-effusive form can be more insidious. The symptoms are more varied, maybe weight loss, a persistent fever that doesn't respond to antibiotics, inflammation in the eyes, or neurological problems like wobbliness or seizures.
Both sound devastating.
They were. For a very long time, FIP was essentially a death sentence. But, and this is truly fascinating and a huge development,
There's been a breakthrough.
a massive breakthrough in treatment, yes.
Yeah.
New antiviral drugs, like one called GS441524, have shown incredible promise.
That work.
They specifically target a key protein that the mutated coronavirus needs to replicate. These drugs are showing remarkable success in treating and, in many cases, actually curing FIP.
Curing it. That's amazing.
It's a really significant shift. It offers genuine hope to cat owners where, honestly, there was none before. It's a game changer.
That's incredible news. It really shows how fast veterinary medicine can move. So, prevention-wise, what can be done? Is there a vaccine?
There's no reliably effective vaccine for FIP currently. The guide mentions that minimizing stress and overcrowding, especially in places like shelters or catteries, might help reduce the overall load of the common coronavirus, potentially lowering the risk of that mutation happening, but it's not foolproof.
Got it. Okay, let's switch gears now to something that can affect both dogs and, less often, cats. Heartworm disease.
Right. Heartworm, caused by parasitic worms, and they can get surprisingly long, up to a foot long sometimes.
A foot, wow.
Yeah, a bit unsettling. They live, as the name suggests, in the heart, the lungs, and the major blood vessels connected to them.
And how do pets get them?
It's transmitted by mosquitoes. The mosquito bites an infected animal, picks up tiny immature larvae called microfilaria.
Okay.
Then, when that infected mosquito bites another dog or cat, it injects those larvae, which then travel through the bloodstream, mature, and eventually settle in the heart and lungs as adult worms.
And the symptoms? They're different in dogs and cats, aren't they?
They awfully present differently, yes. In dogs, you might see a persistent cough that just lingers, lethargy, maybe they tire easily during exercise, weight loss, difficulty breathing.
Sounds serious.
And in severe cases, it can lead to signs of heart failure. In cats, though, the symptoms can be much more subtle, sometimes even vague.
Like what?
It might look like asthma coughing or wheezing, sometimes intermittent vomiting. Or tragically, in some cats, the first and only sign can be sudden collapse or even sudden death.
Oh my gosh, that's scary. Is there treatment?
For dogs, yes, there is a treatment protocol. It involves a series of injections, usually arsenic-based, to kill the adult worms.
That sounds intense.
It is, and it requires strict exercise restriction during and after treatment because as the worms die off, they can cause blockages. It's also risky and can be quite expensive.
And for cats?
Unfortunately, there is no approved or safe treatment to kill adult heartworms in cats. The drugs used in dogs can be fatal to cats.
So what do you do for cats?
For cats, the focus is almost entirely on prevention. If a cat does get infected, treatment is aimed at managing the symptoms, like respiratory issues, but we can't eliminate the worms themselves safely.
Which brings us straight back to prevention being absolutely critical.
Absolutely crucial. The guide emphasizes this strongly. Using monthly heartworm preventatives, oral chews, or topical liquids is highly effective. We're talking nearly 100% effective at preventing infection.
So it's a simple, relatively cheap way to avoid a really dangerous disease.
Exactly. Consistent year-round prevention is key, even in areas where you might think mosquitoes aren't a year-round problem.
Good advice. Okay, next up. A bacterial infection more common in dogs, leptospirosis.
Leptospirosis, or lepto. It's caused by bacteria, spiral-shaped bacteria called leptospira.
And how do dogs pick it up?
It's spread through the urine of infected animals. This can include wildlife rodents or common carriers, raccoons, skunks, even deer.
So dogs get it from the environment.
Yes. Either direct contact with infected urine or, more common, like contact with water or soil that's been contaminated by that urine. Think puddles, ponds, slow-moving streams, damp soil.
And what does it do to the dog?
The bacteria primarily target the liver and the kidneys. The illness can range from mild, almost unnoticeable, to very severe and life-threatening. The fatality rate can be moderate to high, depending on the strain and how quickly it's treated.
What are the symptoms to watch for?
They can be pretty varied, sometimes vague initially. Fever, muscle pain, or stiffness. They might seem reluctant to move.
Okay.
Vomiting, diarrhea, sometimes jaundice, that yellowing of the skin and eyes indicating liver involvement. And signs of kidney failure may be increased thirst and urination at first, but then potentially decreased urination as the kidneys shut down.
Sounds really unpleasant.
It is. Early diagnosis, usually through blood and urine tests, and prompt treatment are really crucial for a better outcome.
Treatment involves antibiotics.
Yes, antibiotics, typically doxycycline, are key to clear the bacterial infection. Plus supportive care, like IV fluids to support the kidneys and manage dehydration. The sooner treatment starts, the better the chance of recovery and minimizing long-term organ damage.
And prevention. Is there a vaccine?
Yes, there are vaccines available for leptospirosis. They cover the most common strains, or serovars, that cause disease in dogs. It's often recommended for dogs considered at risk.
Who would be considered at risk?
Dogs who spend a lot of time outdoors, especially in rural or wooded areas, dogs who swim in ponds or lakes, dogs who might encounter wildlife or rodents. Also, trying to avoid letting your dog drink from stagnant water sources helps.
Makes sense. Okay, moving on to something that sounds like a human illness, but for dogs. Canine influenza or dog flu?
Right, canine influenza. It's a contagious respiratory virus, similar in concept to human flu, but caused by different influenza. A virus strain specific to dogs.
And it spreads easily between dogs.
Very easily. Through close contact. Think dog parks, boarding kennels, daycare, groomers. It spreads via respiratory droplets from coughing, sneezing, even barking.
Is it usually fatal?
The fatality rate for the flu itself, in otherwise healthy dogs, is generally low to moderate. However, the real concern often comes from secondary bacterial infections.
Pneumonia.
Exactly. Those secondary infections can lead to more severe complications like pneumonia, and those can definitely be serious, even deadly, especially in very young, old, or dogs with other health issues.
What are the typical symptoms? Like a bad cold?
Pretty much. A persistent cough is very common, often described as a honking cough. Nasal discharge, which can be clear or thick. Fever, lethargy, just acting unwell, and often a reduced appetite.
Sounds miserable for them.
It does. Treatment for uncomplicated dog flu is mainly supportive care, rest, making sure they stay hydrated, maybe cough suppressants if the cough is severe, fever reducers.
Antibiotics.
Only if there's evidence of a secondary bacterial infection. Antibiotics don't work on the virus itself, remember.
Right. And prevention. Are there vaccines for dog flu?
Yes, there are vaccines available now that cover the main strains of canine influenza circulating in North America. Good hygiene is also important, especially in places where dogs congregate, hand washing, cleaning surfaces, and obviously avoiding contact with dogs that are clearly sick.
Okay, let's shift gears a bit now to something that often creeps up with age. Chronic kidney disease, or CKD. affects both dogs and cats, right?
Yes, very common, particularly in older pets, especially cats. CKD is a progressive, gradual, and unfortunately irreversible decline in kidney function.
So the kidneys just slowly stop working properly over time.
Essentially, yes. They lose their ability to filter waste products from the blood, regulate hydration, balance electrolytes, and produce certain hormones.
And because it's gradual, you might not notice it right away.
Exactly. Kidneys have a lot of reserve capacity. So often, symptoms don't become really obvious until a significant amount of kidney function, maybe 2/3 or even 3/4, has already been lost.
What are the signs when they do appear?
Increased thirst and increased urination are classic early signs. The kidneys can't concentrate urine effectively anymore, so the pet drinks more to compensate.
Okay, I've heard about that.
Then often weight loss, even if their appetite seems okay initially, maybe vomiting, poor coat quality. And a really distinctive sign can be bad breath, often described as having an ammonia-like or metallic smell.
Oh, interesting. Why is that?
It's due to the buildup of waste products, like urea, in the bloodstream that the kidneys aren't filtering out properly. And eventually, lethargy and weakness set in.
It sounds like a slow decline. Heartbreaking.
It can be. And while there's no cure for CKD, the goal of treatment is management. We focus on slowing the progression of the disease and maintaining the best possible quality of life for as long as possible.
How is that done?
Dietary management is huge. Special prescription kidney diets are designed to be lower in protein, phosphorus, and sodium to reduce the workload on the kidneys. Fluid therapy is also important, either giving fluids under the skin at home, which many owners learn to do, or sometimes IV fluids if they get dehydrated. Plus, medications to manage things like nausea, high blood pressure, or electrolyte imbalances that often accompany CKD.
And the guide mentions early detection is helpful.
Very helpful. Routine blood work and urinalysis, especially as pets get older, say over 7 or 8 years old during their annual checkups, can pick up early signs of kidney changes, sometimes before the pet even seems sick.
So you can intervene earlier.
Exactly. Starting dietary changes or other management strategies earlier might help slow down how quickly the disease progresses.
Okay, now let's tackle a really big topic, sadly a major issue, especially in older pets. Cancer.
Yes, cancer. It's a leading cause of death in older dogs and cats, unfortunately. And it's not just one disease, right? It's an umbrella term.
For many different conditions.
Exactly. All characterized by that uncontrolled abnormal growth of cells. These cells can invade nearby tissues and potentially spread or metastasize to other parts of the body.
And it can affect pretty much any part of the body.
Virtually any organ system, which is why the symptoms, treatments, and outcomes are so incredibly varied.
The guide lists some common types. Lymphoma.
Lymphoma is a common one, affecting the lymphatic system. Osteosarcoma, an aggressive bone cancer, often seen in large breed dogs.
Mammary tumors.
Yes, especially in unspayed female dogs and cats. Mast cell tumors, which are common skin tumors but can also occur internally. Hemangiosarcoma, a nasty cancer of blood vessel lining that often affects the spleen or heart. It's a huge range.
It really is. And the fatality rate obviously depends hugely on the type and stage.
Completely. It depends on the specific cancer, how aggressive it is, whether it has spread, where it's located, and how the individual pet responds to treatment. Symptoms are also incredibly varied.
But are there general warning signs owners should look out for?
Some general things to be aware of, yes. Any new lumps or bumps that appear or change. Unexplained weight loss is a big one. Difficulty breathing, or trouble walking, or lameness. Any unusual bleeding or discharge from any body opening. Sores that just don't seem to heal. Loss of appetite, persistent vomiting, or diarrhea. Basically, any significant change in your pet's normal routine or appearance warrants a vet check.
And treatment options have improved, haven't they?
They have, significantly. Surgery to remove tumors is often the first step if possible. Chemotherapy, using drugs to kill cancer cells, is much more common and often better tolerated in pets than people expect.
Really?
Yeah, the goal is usually quality of life, so dosages are often adjusted to minimize side effects. Radiation therapy is another option for certain tumor types. And importantly, palliative care, focusing on keeping the pet comfortable and pain-free when a cure isn't possible.
So prognosis varies a lot.
Hugely, which again really emphasizes the importance of early detection. Those regular vet checkups, feeling your pet over for lumps, it can make a real difference.
And the guide notes spaying or neutering can reduce risks for some cancers.
Yes, particularly mammary tumors and testicular cancer, obviously.
Good to know. Okay, finally, let's discuss a metabolic disease. Diabetes mellitus.
Diabetes. Similar to human diabetes, it's about problems with insulin. Either the pancreas isn't producing enough insulin, or the body's cells aren't responding properly to the insulin that is produced.
And insulin is needed to regulate blood sugar.
Exactly. Insulin acts like a key, letting glucose or sugar move from the bloodstream into the cells to be used for energy. Without enough effective insulin, glucose builds up in the blood to high levels.
Hyperglycemia.
Right. And that high blood sugar, over time, can damage various organs, eyes, kidneys, nerves. If it's left untreated, diabetes can lead to serious complications and can definitely be fatal.
What are the classic signs owners might notice?
The big ones are often increased thirst and increased urination. Your pet might be drinking way more water than usual and needing to go out constantly, or having accidents in the house.
Right.
Also, weight loss. Despite having a normal or even increased appetite, especially early on, that combination is a real red flag.
Increased appetite but losing weight. That's counterintuitive.
It is. It happens because the body's cells are starved for energy. Even though there's lots of sugar in the blood, they can't use it without insulin. So the body starts breaking down fat and muscle for fuel, leading to weight loss, while the brain still signals hunger.
Makes sense. Any other signs?
Lethargy, decreased energy levels, and a really specific sign, especially common in dogs with diabetes, is the rapid development of cataracts in their eyes.
Causing vision problems.
Yes, it can lead to significant vision impairment or blindness relatively quickly in dogs. Cats don't tend to get cataracts from diabetes as commonly.
How is diabetes treated in pets? Is it insulin shots?
Yes, treatment typically involves daily insulin injections, usually given by the owner at home after learning how. Careful dietary management is also key, often a prescription diet that's consistent and helps regulate blood sugar.
And monitoring.
Regular monitoring of blood glucose levels is crucial, often done at home with a glucometer, similar to human diabetics, under veterinary guidance to ensure the insulin dose is correct.
Can diabetes be prevented?
We can't prevent all cases. There can be genetic factors, but maintaining a healthy body weight through a balanced diet and regular exercise is really important. Obesity is a major risk factor for developing diabetes, especially in cats.
So keeping them trim helps.
It definitely reduces the risks significantly. And again, catching those early signs, the increased thirst, urination, the weight loss, despite good appetite, and getting them checked out promptly is key.
Absolutely. It seems like vigilance is the common thread here.
It really is. Knowing your pet's normal behavior and noticing changes early.
Well, this has been quite a deep dive, really comprehensive and, yeah, sometimes quite sobering, looking at these serious diseases from the guide. It absolutely drives home just how vital it is for us to be vigilant, to be informed pet owners. Understanding these potential issues feels like it can genuinely make a difference.
That's absolutely the key takeaway. While hearing about all this might seem overwhelming, the guide also really emphasizes the positive side. Many of these serious diseases are preventable, or at least they can be managed much better with proactive, consistent care. Those routine vet checkups are so important. Staying completely up to date on recommended vaccinations, using effective parasite control year-round, these are really powerful tools we have.
So the message isn't doom and gloom, it's empowerment through knowledge.
Exactly. It boils down to this. Pay close attention to your pets. Really know them. Notice any unusual changes, behavior, appetite, energy, their physical appearance, even subtle things.
Don't dismiss small changes.
Don't dismiss them. And if you have any concerns, even a little niggle, please don't hesitate. Reach out to your veterinarian promptly. Early diagnosis and treatment makes such a difference for so many of these conditions.
It's a big responsibility owning a pet.
It is a profound responsibility for their health and well-being.
But the reward, that connection, that unconditional love, it makes it all worthwhile, doesn't it?
Absolutely.
Maybe, just reflecting on our conversation today, perhaps you, listening, might think about one specific proactive step you could take, maybe starting today, to further safeguard the health and happiness of your own furry family members. What's one small thing you could do? That worry you feel is